Concussion, also known as mild traumatic brain injury, is a significant issue in the military. If not treated effectively, it can negatively affect mission readiness. Even though concussions can occur while deployed, most concussions occur in garrison as a result of falls, sports injuries, and motor vehicle collisions. Hello, and welcome to the Traumatic Brain Injury Center of Excellence, or TBI-COE's, Progressive Return to Activity training videos. My name is Amanda Gannell, and I will be your guide throughout these trainings. As you just saw in the introduction, concussions can occur in a variety of settings and can affect mission readiness. This is video number 1 in the training suite, which includes 7 short videos and a summative clinical case scenario, which are designed to facilitate your ability to manage concussion using the Progressive Return to Activity, or PRA, process. We suggest you have a digital copy of the PRA clinical recommendation to refer to as we advance through these videos. You can pause this video while you download the PRA CR from the TBI COE website by going to health.mil/TBI providers. In this lesson, you will learn about the rationale for using a progressive return to activity process and receive an overview of the 2021 TBI COE PRA algorithm and supplemental tools. By the end of this video, you will be able to describe the PRA process for service members diagnosed with concussion. Current literature recommends that patients gradually return to normal activity by using a progressive return to activity protocol. A 2019 study of TBI-COE's PRA in the American Journal of Sports Medicine concluded that training medical providers on the PRA-CR for management of concussion resulted in greater symptom resolution for their patients after injury. So, what is the progressive return to activity process? Similar to a return to play or return to learn process, the PRA is a stepwise protocol designed to return service members to full duty as quickly and safely as possible after a concussion. The PRA should be used for all service members diagnosed with a concussion, whether they're deployed or in garrison. Progression is based on subjective and objective assessment of symptoms as patients advance from relative rest to return to full duty. Each stage introduces increasing demands on both the physical vestibular and the cognitive oculomotor systems. The algorithm begins with recognizing that the service member has been involved in a potentially concussive event. The provider, medic, or corpsman administers the Military Acute Concussion Evaluation, or MACE-2, ruling out any red flags. If a concussion is diagnosed, the provider performs the initial concussion management, setting the expectation for full recovery, initiating 24 hours of rest, and scheduling a follow-up with their primary care manager, or PCM, in 24 hours. It is important to note the number of concussions a patient has sustained in the last 12 months. If a service member has had 3 or more concussions in the last 12 months, they should be referred to a higher level of care for a recurrent concussion evaluation. The patient should progress through the PRA protocol and continue follow-ups with their PCM while awaiting their specialty referral evaluation. Patients advance through the PRA stages using the instructions for progression that will be described in video number 4. It is also recommended that patients follow up with their PCM every 3 days to ensure close observation during the process. You will notice red lettered superscripts and light blue links throughout the algorithm. Clicking the blue links within the algorithm will send you to more detailed guidance within the PRA, or will download additional resources. For example, if a service member is not progressing through the PRA as expected, letter J references primary care management strategies that can be implemented. Click the link to navigate to the symptom-guided management table. In addition to the PRA algorithm, the clinical recommendation includes the Patient and Leadership Guide, also known as the PLG. The PLG provides an overview of the PRA process and answers common questions that command leadership may have, including any duty modifications. It also outlines activities that a service member should and should not perform in each stage of the PRA. It is important that the PLG is given to every service member with a concussion and that it is shared with their chain of command. The PRA also includes a link to frequently asked questions to help clarify common scenarios encountered by providers during the PRA process. In this video, we covered the benefits of implementing a progressive return to activity process and provided an overview of the PRA clinical recommendation. Next, let's learn about the major changes in TBI COE's revised PRA. That's coming up in video number 2.